to stay unmuted the whole time?
No, I don't think you have to, as long as you remember to go back and forth.
All right, welcome to our 9th Facebook Live with the Medical Association of the State of Alabama. My name is Aruna Arora. I am the president of the association. I'm here with Dr. Scott Harris, our state health officer, and I'm here with two lovely guests, pediatricians at Children's of Alabama. We've got Dr. Candice Dye, a pediatrician, and we've got Dr. Julie Wolfson, a pediatric hematology-oncologist. And we're excited to cover COVID and children in today's episode. So Dr. Harris, you want to go ahead and give us an update?
Sure, absolutely. Thank you so much for joining us. We really appreciate our friends joining us for this today. These have been great broadcasts. We've been here every Thursday now for the last couple of months, almost 3 months, I think. And so it's always a great learning opportunity, and we just appreciate all the people who are tuning in. In terms of our case numbers in the state, we are seeing a little bit of improvement over the past 10 to 14 days or so. Our total case numbers that are reported to us each day are better, although they're not really very good. We've been somewhere in the range of between 1,000 to 2,000 cases reported each day. That would have been terrifying a year and a half ago, but given where we've been in July and August, that's actually quite a bit better. Subsequently, our hospitalization numbers have also improved somewhat. We are down below 2,000 total inpatients around the state right now on any given day this week, and that's definitely a lot better than where we have been at almost 3,000 really just only 3 or 4 weeks ago. We do continue to see a number of pediatric hospitalizations. I know our guests will be talking about that today. One thing that we've not seen improvement on yet, and the most important statistic probably is the number of deaths, and as we've talked about many times, deaths are a lagging indicator. That's the last number we see to go up when we have a surge, and then that's the last number we see to return towards normal when we see improvement. Unfortunately, many people when case numbers fall, people aren't getting admitted to the hospital as much, but there's still a lot of people in the hospital, and if they aren't well enough to be discharged, sometimes unfortunately they succumb. And so we've actually investigated and identified more than 100 deaths a day for each of the last 3 days. Now, those didn't all occur in the last 3 days. We investigate those and verify those, but our hospitals continue to report typically 4 or 5 dozen deaths per day around the state. And if the past is any indicator, we can probably expect that to go on for another week or two. Unfortunately, that's really, really unfortunate. As you know, the number of deaths we've experienced here in Alabama now are more than 13,000 deaths in our state. In the past year, we've had more deaths occur in Alabama than births in Alabama, and that has never happened before in the history of our state. Our state literally shrunk last year, and the excess number of deaths we are seeing is about the number of COVID deaths that we're seeing. That's literally the cause for that. So that's a terribly unfortunate thing. We are seeing immunization levels, or vaccination levels, I should say, that are improving. We are glad about that. Alabama now ranks ahead of about 8 other states in terms of people who've received at least 1 shot. We have a long way to go to be where we would like to be, but we are seeing that improvement recently, which is good. Finally, I wanted to mention the use of monoclonal antibodies. I know that's been talked about quite a bit lately because of the way the federal government has changed how those are allocated. We have seen somewhat of a decline in what's available to us here in Alabama. Alabama is one of those states that uses a lot of monoclonal antibodies because we have a lot of unvaccinated people, and that means we have a lot of people who get infected and are at risk for serious illness and qualify for a monoclonal. So this is the first full week that we've been under this new system. Alabama is going to receive a little less than 7,000 doses of monoclonals this week, and you compare that with about 19,000 requests we've got from providers in the state for monoclonals. So really only about a third of what people are requesting is going to be available to us. So that's going to be something of a challenge. But that's really all the update I had, Dr. Arora. I'd be glad to answer any questions.
Um, Dr. Harris, you want to say anything about the boosters conversation?
Yeah, thank you. So this is actually happening in real time. Depending on whether
Yeah.
you're watching on your computer or on TV, you can actually see all this play out in front of you as we're having this conversation. Just about 10 minutes ago, the advisory committee to the CDC voted to approve booster doses for people 65 years of age and up who have received the Pfizer product and are at least 6 months out from when they received the second dose of the Pfizer product. Most of the committee, not unanimously, but most of the committee also approved booster doses for people age 18 and up that have age 50 and up, age 50 and up who have certain high-risk medical problems as well. So those, if you remember, were one of our priority groups that we worked to vaccinate early on. A lot of those people are now about 6 months after receiving their second dose. So there are a number of people that are going to be eligible for that. The meeting is still going on. There's still some other things that have to be determined as well. There are going to be some people that have certain occupational or residential risk, depending on where they live, like nursing home patients. It's expected that those people will be approved for booster doses as well, regardless of their age or other medical problems, just by virtue of being in a facility like that. It's not clear yet if that booster dose recommendation is going to apply just to people who are in public spaces all day and who face risk because they're around other people. Think of teachers or grocery workers or some of those kind of groups. So we hope to have a little more clarity on that by the end of the day today. Stay tuned for that.
Thank you for the update. Okay, so Dr. Dye and Dr. Wolfson, it's really, an honor to have both of you on today, as both of you have been involved in some grassroots advocacy from a physician standpoint in your region, with the masking in schools before school started in August. And so it started regionally within your area, but then it kind of grew from there. And reached, somewhere in the 450 range of physicians now. And it was a letter that was directed to our state superintendent, Dr. Mackey, regarding, just to allow all local superintendents to follow the science. And it was really a very powerful message to us. So I'll start with you, Dr. Dye. Anything that you want to add in regards to that message that y'all started?
Yeah, and I think that Julie gets the major credit. It's been great teamwork, but the guidance that we have offered is to listen to the experts, to follow the experts, and the physicians, public health that are in the throes of this, and that's what we are trained for. That's what they are trained for. And so to take those recommendations from the ADPH and implement those, and the superintendents and different city councils and so forth to follow those. They're many times have said we are not physicians, we are not medical personnel, and so why are we making these decisions, and they shouldn't be making them, but helping to implement them from those experts. And so that's really been the push that we have hoped to succeed. So
Well, I know I sat side by side with you answering phone calls, at our phone bank in Birmingham, and just watching all the questions that were coming about children, and leaning over to talk to you about some of the advice that was being, given by y'all on a daily basis to your patients. Is there a highlight of advice that you want to share for parents that are considering vaccinating their children?
yeah, I think it's have that conversation with your physician, and look to your physician, your pediatrician, to help guide those conversations and to answer those questions that you have on whatever basis. But there are a lot of questions out there. There's a lot of information out there. There's a lot of misinformation. And so to sort through that as a lay person, even, as a physician is sometimes, very, very difficult. So, looking to your trusted physician to have that conversation and to, see what messages they are putting out there. So every person that, ask a question, every patient, parent, and we get somewhere, and it's a huge victory. It's a lot. And I wish that we could do that with every single person that, that has those questions. One parent that I was talking to within the last probably, month or so, she said, "Oh, wow, really? Well, I'm gonna have to tell my, family and stuff." And I said, "Yes, please, this is the truth," and, help spread that message and not the other things that are out there. So.
And I think that really comes, to play with what you mentioned, which is just having those conversations based on trust. And so the families that are looking to you are looking to you because they trust you and they want to hear what your personal opinions have been to your family members about the vaccine. And that is really kind of more important than some of the numbers and the statistics to people at the end of the day. So that's really important. Thank you for sharing that. Okay, Dr. Wolfson, I know that we have discussed many conversations and you are a very passionate woman about a lot. So as you would expect, a pediatric hemonc doctor, that continue to have hope. So your patients are very much, in situations where they need the rest of us as the community to protect them. And so your messaging about masking and the reasoning behind the masking and your article about quarantine, can you talk a little bit about all of those topics?
It's interesting because my patients will come to me, gosh, we talk about such serious things, right? We're talking about their kids being diagnosed with cancer, and we're talking about what chemotherapy looks like. And some of these conversations about masks and vaccines have been harder, right? Like there's so much information out there that they're getting that doesn't necessarily gel with what the science is, that we spend sometimes just as long talking about the vaccine for one of their kids as we did about chemotherapy when I first met them. But we take the time to do it because there are patients and we have that relationship. I'm glad that we can have that relationship so that we can work through it. But I think, yes, the kids with cancer are getting sicker than the kids with the general pediatric population. But it doesn't, I think that the fallacy out there, or there's a myth that kids don't get sick in general, right, from COVID. And I think that's what Candice and I have been so worried about, is that there's this myth that, send your kids to school, no one needs to wear a mask, it'll be a cold, let it run through them, it'll be fine. And that's not what we're seeing, right? I mean, we're seeing healthy kids get sick, and they're up to like almost 25% of all COVID patients right now are kids. And that's just, it's just getting bigger. In some ways, I'm sure that's because everyone else is vaccinated and but they haven't had access to that yet. Gosh, it'd be great if it's soon. And it sounds like that's on the horizon, right? I know.
Yes.
But what we can do until they're all vaccinated is we can do what the CDC has these great guidelines that have been very thoughtful in trying to keep things practical, but also keep kids safe and keep teachers and staff safe. And the AAP, the American Academy of Pediatrics, is very much in line with that. And I think Dr. Harris's ADPH guidelines were very much in line with those. I mean, it's a very, very nice, clear, concise way to do things. And last year, gosh, everybody was so on board, and all the schools said, we're going to keep our kids safe. But, God, we're all over this, right? I mean, we're all sick of it.
Yeah.
I don't like wearing a mask. I'm done with wearing a mask too. My kids are very done with it, but they do it, right?
Right. Absolutely.
They forget to take it off when they get in the car, right? Because it's just so much the fabric of who they are. But I think what we can do until all those kids get vaccinated is we can try to keep everybody safe in ways that, those non-pharmacologic ways, right? The ways that we keep our distancing and our masking. And gosh, it'd be great if we had perfect ventilation everywhere, but I know not every school can do that. And I know, so until we can get to that point where kids have this vaccine immunity, that we've really been trying to kind of, like Candice said, kind of spread that message of, let's just all listen to these guidelines, that these are great educators in great school districts, and you have your own struggles that you know how to fight and you know how to manage. But let's, if I'm I don't know, I'm a pediatric oncologist, someone comes in with a broken bone, I send them to the orthopedic surgeon even, right? I'm not going to pretend to know how to set a bone. I mean, I did some casting back, that was a long time ago, right? I'm not going to pretend. So in the same way, we're going to look to the public health experts, right? And so I think
Absolutely.
even more so, these great educators, they want to educate the kids, and they're so frustrated that sometimes I think that they can't focus on educating them. And I think the solution is then you turn to the experts in medicine and public health for those guidelines and say, fine, we'll just do it that way. And I think that's what these 400, we're up to 436 doctors now on the letter. And it's very much a statewide coalition, I would say at this point, right? I mean, we've got counties from down by Mobile to up to Florence and out towards Enterprise. And I think, and everybody really is just of the mindset of, let's just do this uniformly and do it as consistently as we can. Because I think what happens is when, I know I'm probably going into a direction you didn't ask me to go, but when these schools start saying, you know what, we're going to pick a metric and we're going to say, okay, well, we get to X%, then we'll stop. And then we'll start again. If it goes up to Y%, then that's kind of messing with what the intent of the guidelines is, right? I mean, these folks, the health experts, the public health experts are following the data. I mean, you and Dr. Harris live in the data, right? So when it's time to shift, they'll shift, right? And so if we're all in it together, we'll shift when it's time. It's not a forever thing either. I think that's a really big concern out there too, is that, oh, we're going to do this forever and no one's ever going to stop masking. And if we do it now, it's forever, ever. We'll shift when the data shifts, but together as a state, when Dr. Harris says it's time. I'm not just saying that because he's listening.
Right. No, absolutely. I think that is a very important point, because I think part of the reason for the loss in, enthusiasm to do all the various mitigative measures, the Swiss cheese model, is because, well, okay, so now you're asking us to do this, but when are we going to stop? When are we going to live our life? When? And it's ultimately that question that sits on, people's minds and makes them make a choice this way or that way. And it's something that Dr. Harris can speak to, but, the case rates, the percent of vaccinations, these are the, so there are things that we look to in order to say, hey, now it's time. And Dr. Harris, if you want to comment on that.
Yeah. So I think one thing that we want to remember is that identifying a metric, like Dr. Wolfson said, and just saying, when we hit this point, then suddenly we're done with, all the things we're trying to do to protect kids, is really a really artificial way of trying to do things. I mean, first of all, every single county in the state of Alabama is at a very high level of transmission, or at least substantial or high. And in both of those cases, public health experts like CDC say that all people vaccinated or not need to be masking in public spaces. And so that, not even speaking in particular about schools. So the idea that you can find some percentage of kids in the classroom who have this metric or that metric really kind of ignores what's going on in the community as a whole. And so, what, kids do in the four walls of the school building, is important, but it's not the only place they spend all their time, and it's not where their family members are spending most of their time. And so we really do need to have a bigger picture about what's going on. I would say we would really like to have a really clear, solid picture of going, this is the day we flip the switch and everything's normal again. But we're just not there at this point. It's only been 4 or 5 days that we had negative ICU beds in the state of Alabama because we had too many people who were sick needing critical care to find beds for. And that number might change by the end of the day again. We might be negative again. So we are going to get through this together, but the best tools we have are these non-pharmaceutical measures that were just mentioned, wearing masks and washing your hands and keeping your distance. And then for those people who are eligible, getting vaccinated. That doesn't apply to smaller kids, but it certainly applies to, some adolescents and teenagers And so we want people to get vaccinated as quickly as they can. That's really the best tool that we have.
100%. I think the fact that we are sitting in such a gentle balance, with the hospital situation and the monoclonals going down, and just the evolving nature of this virus. I mean, we certainly don't want to tempt fate by relaxing measures in places like schools, so and the 5 to 11-year-olds, cross our fingers, but, by the end of October, beginning of November, hopefully we see something promising there. So there are changes that are happening here, that are giving us hope that things are going to change, but we all have to do our part to help. And the schools certainly are a big part of that. Dr. Wolfson, you had mentioned ventilation, and that is often something that just gets lost, in the conversation of one of the mitigative measures. But I know, in our state, I mean, the weather is always so nice. So as many things that can move to the outdoors, windows, things like that are very helpful. So, and then Dr. Harris, any comments about the athletics? Have we heard anything from the Athletic Association in terms of where we are in schools and what we're doing?
Yeah, so we've had a lot of great conversations with AHSAA. Coach Savarese, who was there until this past year, and now Mr. Alvin Briggs has taken over as director of that organization, and they've been terrific partners. They have really worked hard to try to implement the best guidance that we have that we can put together. There are always going to be levels of risk with any activity, and so there's no way to do things perfectly. But there, even though not every activity can be completely safe, most activities can be done in a more safe way. They can be safer, so we've learned a lot in the past year and a half. We had a lot of concerns a year and a half ago with, do we disinfect the baseball between every pitch or not? Those kind of things that in a way have turned out to be kind of silly if you think about it, but we really didn't understand transmission very well when all this began. Now what we do understand is that, having large groups of people together from different households, particularly if you're not sure about vaccination status, there's going to be some risk there. I mean, there's no doubt about that. And for people that are personally at high risk because of their medical history or other issues, those situations are best avoided. For athletics, though, outdoor activities are always going to be better than indoor activities, or in most cases are going to be better than indoor activities. Trying to limit the amount of time people have to be really close together is really important. If you're on a football field, there's contact you're not going to be able to avoid. But when you have people packed in a locker room before or after a game, or even on the sidelines, you certainly do have some control, over that. And then finally, I would say this is not maybe as much applied to high school athletics, but football season in Alabama, of course, is a really big deal. We all kind of sit up and take notice when you see 100,000 people packed into a single stadium. That's a little unnerving to see that. And yet I will say that's not nearly as big an issue as the many hundreds of thousands of Alabamians who are in each other's living room, and they're packed together all weekend long, and they're sharing a meal, and they're having a great time and doing all the things we all enjoy doing. We just don't want to forget the fact that we have a deadly disease out there. We still have thousands of cases being reported every single week. We have cases reported from every county in the state every single day. And people really need to remember that and try to take the appropriate precautions.
I think that's really good advice. Dr. Dye or Dr. Wolfson, can either of you comment about adolescents and long COVID and what you were seeing? It seems to be the lost, forgotten conversation, oftentimes long COVID. We always, get concerned that everyone's in the ICU, but many people who just have mild symptoms end up having, some post-viral sequelae that stay with them.
I think it's really unfortunate that the narrative has been really focused on death, right? Because there's so many things that happen after you've had this virus that when you do survive. And unfortunately, there's so many folks out there, like families that I talk to haven't even heard the word long COVID, and I end up explaining to them what that means. But I think We know that yes, it's now COVID is one of the top 10 causes of death in adolescents. But the fact that we have this many adolescents getting sick with COVID, and we know that up to, almost 8 to 10% of them can have long COVID, it's really, it's really a problem. And it really can affect their life. And it's such an important developmental stage that it can affect even further into the next phase of life as well. And these can go on for, more than, 4 weeks, 6 weeks, up to 6 months. And I think what's nice is that the NIH has just funded a study where we'll learn more and more about long COVID. And I think we just don't know enough about it to be able to focus on how to prevent, treat, and rehab from it. But I know I don't know, Dr. Dye, if you've been seeing it as much in the outpatient setting or if it's been mostly in the infectious disease clinic.
Yeah, I would say that it has been more in the infectious disease clinic, where these patients are certainly being, seen and followed. So
I was just going to say the other thing that comes to mind when we talk about things that aren't dying from COVID is that if your hospitals are full with kids of COVID, and you were just on the hospital service, Candice, right? It's pretty crazy that there's no room for the other kids that have illnesses, right? That need to be hospitalized, just in the same way that the adults have to be flown out of state for something cardiac or whatever. The kids are in the same position. There's no room in the inn.
Yeah, that is definitely a delicate balance. It affects non-COVID related hospitalizations and illnesses as well. So, one of the myths surrounding wearing masks amongst children is parents concerned that their children are not building up the immunity that they need. And, this high rise of RSV that we had seen, being related to the mask wearing. Can either of you comment on that?
yeah, Julie may be able to do it maybe a little bit more eloquently than me. But I think part of my thought, looking at that is that, again, it proves that masks do work. We have had absolutely zero inpatient flu cases, influenza cases since over a year ago, and that's a whole nother conversation as we're about to get into to that season. But yeah, it was really interesting this summer when I was on inpatient and even in outpatient, that there were some of our residents, interns, that had not taken care of an RSV patient until June or July, and so, or not to the degree that we expected in the winter. So
Right. Yeah.
Yeah, so it's more the fact that they weren't getting it before because
Right.
the mask was protecting them
Right.
rather than the mask was kind of preventing them from getting some kind of healthy exposure that's building up their immune system, which I think becomes a little bit of a myth too.
Right, absolutely. And, there's so many observational studies. I know even UAB, Rachel Lee did a beautiful study. The North Carolina school systems had a beautiful study with a really, their power was really high because it was all the schools and charter schools, showing that the masks do work to prevent secondary transmission in schools. And so, while people may be hearing that the masks are not needed, and I have heard that there are doctors out there saying they're not believing in the masks either. I just want all of us to remember, our medical school training. Did we walk into an OR without a surgical mask on?
Right.
No.
Yeah.
I wouldn't
And
want my surgeon to not wear a mask.
Right. So, there's a degree of infection control that is, proven over time. And it's such a simple thing to do, really, in the big picture. And so, it's really a simple ask for, like I said, hopefully not too long, but just, in this time period, if you were to have a loved one who did not even have COVID, but had a non-COVID emergency, you would want them to be seen in the hospital, as Dr. Harris has pointed out, and you all have pointed out, even in the pediatric population. Okay, so I'm going to go. I've got some questions here that have popped up. And so Let's see, one question. What happens to the orders already placed with Amerisource, Dr. Harris? The email from Amerisource stated that the unfilled orders placed with them would be transferred to the ADPH.
Yeah, sure. So as I mentioned earlier, we right now have a request from providers in Alabama for almost 19,000 doses this week. We're actually going to receive less than 7,000 doses this week. And so the the math there is easy to see that virtually nobody's going to get everything they request. We are making every effort to get some product to most everybody, but there are also some providers that we know who have reported to us that they still have some inventory on hand, and if they have a bit of a stockpile that can get them through a few days, then not even we're not going to send additional product to those people. So our pharmacy team has just worked night and day. I mean, they really need a medal for the amount of work that they've tried to do, just adopting this project, that was dropped on us with about a 1 hour notice last week. So actually, I believe tonight or later this afternoon, maybe even by now, providers are all going to receive an email to let them know what's coming. So they'll have some sense of what it is. But I think we all realize no one's going to be happy with what we get, but because we just don't have enough to go around. So we're trying to make sure that there's product in every part of the state, that some of our more underserved areas that don't have a lot of providers still have enough there to try to meet the needs of the population to the extent we can do that. But generally speaking, we're going to try to get it evenly sent out as people have requested, but just realize we've got about a third of what people are asking for.
Yeah, and I know our neighboring state has made some choices regarding how they are distributing the monoclonals, and Dr. Thrasher did report that in our state, we are not having any changes, and so the unvaccinated as well as vaccinated breakthroughs are able to get the monoclonal antibodies. So please make sure you do contact somebody within the 10 days if you were to get sick.
Yes.
Okay.
Can I just add one thing on that?
Yeah,
I
absolutely.
didn't mean to jump in on you.
Yeah, no, you're fine.
Yeah, so the real question is, what do you do when you have a scarce resource? I mean, how do you decide who gets it? And so some states have, sort of put some rules in place. We have not done that in Alabama because we believe that the individual physicians and individual providers, are the ones who are best suited to make those decisions. And so we ask people just to try to prioritize according to those people who are most at risk. Now, there's some actually really good guidance out there that's published by NIH that sort of gives you a strategy for how you would prioritize and who's at higher risk, and how do you compare the 65-year-old mostly healthy person with the 20-year-old asthmatic person. Those are some really kind of delicate clinical decisions there. So we encourage people to look at that and try to make those decisions, but ultimately it's going to be up to providers. And so there certainly may be people who are vaccinated and yet who may be at higher risk because of their comorbidity or age than somebody who's unvaccinated, even though generally speaking, it's the unvaccinated people that are making up about 85 to 90% of our hospitalization.
Okay, and
Can
then
I
we
add
have
something just since
oh
we're on
yeah,
kids,
sure,
that we're because
absolutely.
the 12 and up are actually included in the EUA as well, that some of the high risk kids are eligible too, just for folks who didn't know, and including sickle cell patients and immune compromised patients. But just to put out there that yes, it's a rough spot we're all in, but I couldn't stop myself from throwing that in.
Yeah, absolutely. Thank you. Okay, so this question is about the reduction in the monoclonal antibodies. And the question really is if legislators as well as the ADPH are still lobbying the federal government for this situation.
Sure. We actually had a very long call yesterday with the chiefs of staff for all of our Washington delegation, our senators and Congress people yesterday. So they understand the situation. I would say, I think one thing that wasn't clear when we first started hearing the story is there's a formula that's being applied uniformly to every state. And so the formula is depending on how many cases you have in your state and what your hospitalization numbers are, that's how it's determined what your allotment is going to be. And so that's the ultimate good news, bad news thing. But because in Alabama, we have a lot of cases, we actually are getting a relatively large amount of doses compared to other states. I believe this week we're, even though we don't have anywhere near what we would like, I think there are only about 12 states in the country, including places like Texas and California and Florida, that are getting more doses than us. And, you know, those states that are much, much larger than us. So we're ahead of about 37 or 38 other states in terms of how much we're getting. We do get subtracted or do get punished, if you will, if we don't report how much we're using. So you know, the feds don't want to see stockpiling going on. They want us to be using what we're receiving, because there's just a limited amount to go around. But we're getting, you know, our fair share, if you will. It's just that overall there's not enough to go around. About 150,000 doses a week are available to be shipped in the U.S. And remember, our country's seeing 200,000 new cases of COVID every single day.
Right. Okay. So just to shift. Oh, go ahead.
We do not have a shortage of vaccines or having to ration that
Yes.
at all. So I know we've covered
100%. Yes. No,
Thank
that
you
is
for that point.
a
That's a great
really
point.
good point, and we could not stress that anymore. The vaccines are safe. They are effective. I know there has been a lot of chatter out there that there are doctors saying not to get the vaccination, but I just want to remind people that over 95% of physicians in this country have been vaccinated. And that's just really important to remember. So, okay, so we've got a question. Is it true that if you are not 2 weeks in after receiving the second COVID trial vaccine, you are considered unvaccinated?
I'm not sure if they're just asking about the definition, but people are considered to be fully vaccinated 2 weeks after they receive their second shot. That's you know, kind of the time on average that your body needs to mount a full immune response. In terms, if they're asking about how do we count cases or so on, we actually track people that are fully vaccinated or people who've had only one shot or people who've had no shots at all. And that's part of the numbers that we give out. You know, I think right now our hospitalization numbers show about 85 or 86% of all COVID cases are completely unvaccinated. There's another, you know, 2 or 3% of people who've had at least one shot or maybe two shots, but aren't fully vaccinated. And then the people who are at least 2 weeks out from their second shot who are fully vaccinated is somewhere around 10 or 11% somewhere.
So just to reiterate, that is split up that way. I think that's ultimately where that question is headed. If patients who are partially vaccinated are being in the category or put into the category wrongly. So there are essentially three different.
They've got their own category. Yeah, they've got their own category.
They have their own category.
Yeah, okay. I mean, I think sometimes what we say is you know, 10 or 11% of fully vaccinated people are in the total. And so the remainder includes both those groups, people who are unvaccinated and people who are partially vaccinated. But it's mostly that group is made up of people who are completely unvaccinated. It's around 85%.
Got it. And to the parents out there and to the people out there who believe that COVID is mild in children and the idea to give the vaccine to children when we should just be encouraging the adults to get the vaccine. Any comments, pediatricians?
Lots of comments.
that is a big chatter out there. You know, herd immunity shouldn't use children. You know, we should just continue to encourage our adult population to help us get to that point along with natural immunity. I mean, there are folks out there who believe that and feel that we're putting children in harm's way. So, I mean, you both are children's experts. So I'm asking you both.
Yeah. So, I mean, I think Julie commented about, you know, the percentage of kids that are, you know, that do have COVID making up, you know, a quarter essentially of the cases. And the, you know, overall, they may be milder, but, you know, I mean, the Delta variant is not good. And the longer that we are unvaccinated and the majority is unvaccinated, the more opportunity for those variants to form. And that's just, it is scary. And, you know, even if it, you know, your child or your uncle or whoever had it, and they, it wasn't that bad. Tell that to the family member that is, huddled around their child's bed in the ICU, or their, grandmother's bed in the ICU as well. And so it's, you can be totally asymptomatic and still spread it. And so, I think that that's where this conversation gets really hard, and just to be socially responsible and do it for yourself, but also for everybody that you're encountering, and just to be respectful for that. And so, we all have a right to believe what we want to believe, of course, but the kids need it as much as anybody else. Just kind of blanketly, and and even the school teachers and administrators that they're around every day. I mean, they're, your child may be healthy, and that's great, but their teacher may not be, or the librarian, or whoever that is, that they're encountering. And like it was stated earlier, we are all so over this and so tired of masks. And I have children that both have birthdays coming up, and of course we're pretty strict about things at our household. But having that conversation of why we can't have a real birthday party, and and trying to do that. And of course they probably are even more tired of COVID than maybe some others, but probably not either. And just asked, when is this going to go away? I mean, like we said earlier, and it takes people getting vaccinated at all ages. It doesn't matter. So
I think David Kimberlin and Michael Sag and all of our ID folks, every time we would ever ask early on about vaccine side effects, they'd say, just remember, anything the vaccine, it's nothing compared to what that disease can do, right? And that's really what we've seen, is that people are doing really well with the vaccine, and it's preventing problems as opposed to causing them, right?
Yeah.
And that's the goal. We have the MIS-C, this inflammatory syndrome that, I mean, we're seeing in our ICU. It's awful. It's awful. It's not any, and I think it was really exciting when we found out that not all of those MIS-C kids were dying. But that's another place you go with, oh, well, not all problems with COVID are death, right? I mean, this inflammatory problem with your heart, it's awful. It's awful.
Right. And more risky with COVID than with the myocarditis
Oh my
in
goodness.
the under 30 population. So
Absolutely. I mean, that myocarditis was, you take some high dose Advil, and most of them aren't even in the hospital and they're fine, right?
Right.
These are all in the hospital and have long-term cardiac problems, right?
Right. Absolutely.
It's really sad.
just the comorbidities that are, can come from having the infection are just, I mean, all of that. Of course, you weigh the risk and benefits with anything, and it's just, it's not good. It's not good. I don't want anybody that I know, anybody that I don't know, to have to go through this. And it's just that that's one of the things too, that, I'm of course a general pediatrician and do outpatient and inpatient, but like anticipatory guidance. And, if there is something that we can do to prevent something from happening, then why aren't we doing it?
Right.
It's like, wear a helmet so that if you have a bike wreck, then your head is hopefully going to be, saved from that. And, you do these things to help prevent, act instead of react. And that's just, yes, just please. No,
that's a wonderful way to put it. I think that's absolutely true. Anticipatory guidance here is so important. And I don't know what to say, but I really appreciate the three of you spending, it looks like we hit an hour almost. So I'm sorry. I know we don't normally go this long, but I found this to be really useful. And is there anything that y'all want to add at the end before we kind of wrap up here?
If I could just say one quick thing, and
yeah, absolutely.
and then I'll turn it over to our pediatrician guest. But I'll just say we still are emphasizing vaccinations every way possible. Remember, for those who are getting the 2-shot vaccine, like the Pfizer vaccine or the Moderna vaccine, you need a second shot 3 to 4 weeks after your first shot. You still need a couple of weeks after that to really realize the full benefit of that. And so, if you're thinking about having a safe Thanksgiving, you need to go get vaccinated this week. I mean, you really need to be working on that as soon as possible. So we hope people will prioritize that as soon as they can. Thank you.
That is a great message, because we definitely want people to get together with their families this year, because now we have an option. We have a vaccine that can allow you to do this safely. So please listen to Dr. Harris and plan accordingly. Dr. Dye, Dr. Wolfson.
I think I heard an amazing analogy the other day that I think what I would want the educators to take away from right now is, just because you're dry walking under an umbrella in a thunderstorm, you don't put your umbrella away, right? I mean, I think there's a little bit of an illusion there. So, keep doing what you need to do to keep the kids safe. Hopefully we can get vaccines in all the 12 and ups before Halloween. We're getting close.
Getting close, yes.
And then hopefully in the younger kids soon. But thank you guys for all of that you're doing, Dr. Arora and Dr. Harris.
Absolutely.
All of us out here are grateful.
Absolutely. And you're right. Lena Wen's umbrella analogy is beautiful, because honestly, if the umbrella is your vaccine, like, to all the people who didn't understand how we were still worried about vaccinated people, and at that time, it depends on your community. And, when we were, weeks back, we had raging thunderstorms happening around. And for us to think with that analogy, that even with that umbrella, the vaccine, we weren't going to take a risk of getting wet. I mean, that is just the most beautiful analogy. And so you're right. Dr. Dye?
I don't think I can follow that. But no, just thank y'all so much. And obviously we could talk for a lot longer, but thank y'all for having us today, and just for everything that y'all are doing. And just stay strong, stay safe, and take care, everybody.
I appreciate that. One last comment. I want either of you to tell us about testing. Can you, because I know a lot of parents out there get really confused on testing, the rapid antigen, the positive, the negative, the PCR, and then they convince themselves that the positive is not really positive and it was false, and just go on with life. It's amazing what people do when they're in this scenario versus when they're talking about their friend who did this. Can you believe my friend sent their kids to school? But then when it's them, they're like, I don't think it's positive. I think we're okay. So can either of you talk about this really complex issue?
This is really high tech, but this is Guy's COVID 2.0 notebook. For our clinic, and we have a wonderful team and have spent hours developing the logarithms and weekly and even more meetings and everything. And the PCR is the gold standard. The rapid antigen, I think, has has a little bit more validity. One of the reasons, and Julie, correct me, or Scott, anybody, Aruna, but because the Delta is so bad. And so it's, if it's positive, great. If it's negative, you can't say it's 100% not. I mean, that, and we can talk statistics and everything, but the PCR is the way to get tested and know that for sure. So
totally agree. Although I would say, speaking to what you said, Dr. Arora, that a positive in this where we live right now with the cases around us, a positive is a positive is a positive.
Yeah.
Right.
Yeah.
And so those rapid antigens, you can't call a negative always, but if it's a positive, you treat it as a positive. The amount of I think that I noticed the surge happening again because my phone started blowing up again. What do I do with this test? What do I do with this test? What do I do with this exposure? But it's, I think especially the new at-home rapids like the Binax Now, and these actually, there's some studies that show that they're pretty sensitive. They're very specific and they're much more sensitive than the older ones. So I think that, like we said, a negative might not be a negative, but a positive is a positive. You don't go to school or work or you call your doctor. You call your doctor.
Right. No one wants to be in that situation, but once you're in that situation, handle the situation the way you would want your friend to handle that situation.
Exactly.
Quarantine while you're
Yeah.
handling the situation.
Yes. yes. Well, thank y'all so much. I've really enjoyed the
Yeah.
conversation and I really appreciate it. Thank you for fighting for the children.
Thank
Thank
you all
y'all.
so much.
Everybody.
Thank you.
Thank you, Dr.
Thank you.
Harris.